So in this chapter, we'll be examining pregnancy from the maternal standpoint. We can see it from the fetal standpoint in our following chapter. We'll be looking at the adjustments of a woman's body to pregnancy and the mechanisms of childbirth itself. So gestation or pregnancy lasts an average of 266 days from conception to childbirth. However, generally we'll use a gestational calendar that's measured from the first day of the woman's last menstrual period. Birth is predicted at 280 days or 40 days from the last menstrual period. Term is what the actual duration of pregnancy is, so we might say term is at 280 days. The gestational period is broken up into 3-month intervals called trimesters. Here's some terminology. The conceptus is a term used to cover all the products of conception, the embryo or the fetus, the placenta, and the associated membranes. The blastocyst is the developing individual, is a hollow ball in the first 2 weeks. After that, it becomes an embryo from day 16 through about 8 weeks. At the end of 8 weeks, we begin calling it a fetus. At this time, it's attached by the way of an umbilical cord to a disc-shaped placenta. The placenta provides fetal nutrition, waste disposal, secretes the hormones that regulate pregnancy, is involved in mammary development as well as fetal development. The neonate is the newborn, up to about 6 weeks of age. So there are many hormones involved in pregnancy, but the hormones with the strongest influence are estrogens, progesterone, human chorionic gonadotropin, and human chorionic somatomammotropin. All are primarily secreted by the placenta. However, the corpus luteum is an important source for the first several weeks. If the corpus luteum is removed before 7 weeks, the fetus cannot be maintained and will be spontaneously aborted. From week 7 to 17, the corpus luteum degenerates and the placenta takes over the entire endocrine function. So human chorionic gonadotropin is one of the big markers of pregnancy. It's secreted by the blastocyst as well as the placenta. It's detectable in urine about 8 to 9 days after conception. And this is what we use home pregnancy test kits to detect. Human chorionic gonadotropin stimulates growth of the corpus luteum, which then secretes increasing amounts of progesterone and estrogen. Estrogens increase to 30 times the normal amount by the end of gestation. The corpus luteum is the source for the first 12 weeks until the placenta has developed and takes over gradually between weeks 7 and 17. It causes tissue growth in the fetus and the mother. The mother's uterus and external genitalia enlarge. The mammary ducts grow. Breasts increase to nearly twice the normal size. It relaxes the pubic symphysis and allows the pelvis to widen. Progesterone is secreted by the placenta as well as the corpus luteum also. It suppresses secretion of FSH and LH, thus preventing further follicular development during pregnancy. It suppresses uterine contractions. It prevents menstruation, thickens the endometrium, and promotes proliferation of the decidual cells of the endometrium on which the blastocyst feeds. It also stimulates development of acini in the breasts, which is one of the steps towards lactation. Human chorionic somatomammotropin is secreted by the placenta beginning about week 5. It increases steadily until term in proportion to the placental size. The effects seem similar to growth hormone, but a little bit weaker. It seems to reduce the mother's insulin sensitivity and glucose usage, leaving more glucose available for the fetus. Now, there are many other hormones of pregnancy. The woman's pituitary gland grows about 50% larger during pregnancy, produces markedly elevated levels of thyrotropin, prolactin, and ACTH. The thyroid gland becomes 50% larger under the influences of pituitary thyrotropin and human chorionic gonadotropin that's coming from the placenta. This increases the metabolic rate of both the mother and the fetus. The parathyroid glands, located on the thyroid, enlarge and increase osteoclast activity. ACTH stimulates glucocorticoid secretion. This serves primarily to mobilize amino acids for fetal protein synthesis. So all of these hormones are being secreted to support building of new materials, bones, muscles, regulatory proteins, etc. Aldosterone secretion rises, promoting fluid retention, thus increasing the mother's blood volume because, of course, the fetus is going to need to accumulate some blood volume. Relaxin is secreted by the corpus luteum as well as the placenta. This synergizes progesterone in stimulating the multiplication of decidual cells. It also promotes growth of blood vessels in the pregnant uterus. Here's a schematic of the primary hormone levels during pregnancy. We can see that in the early weeks, human chorionic gonadotropin is playing the role of the placenta. As the placenta develops, it will secrete more and more of its own progesterone to support pregnancy. So estradiol and progesterone are both increasing throughout pregnancy, with progesterone having a pretty steep drop-off in the last couple of weeks. So pregnancy places considerable stress on a woman's body and requires adjustments in nearly all organ systems. So we'll take a look at some of the major impacts here. But first of all, in looking at this figure, you can see that the baby inside the uterus fills the predominant portion of the abdominal cavity. Thus, all the organs are going to become compressed around the outside, and we're going to have pressure on the diaphragm, decreasing lung volume, right? Pressure on the urinary bladder. So as you can see, the impacts of pregnancy are going to be widespread. First, let's look at the digestive system. In the first few months of gestation, morning sickness may arise. This is usually nausea that's prevalent, particularly at the point of arising from bed. We'll also see constipation and heartburn, which are due to reduced intestinal motility. We'll see pressure on the stomach, which causes reflux of gastric contents into the esophagus. Pregnancy will have some big effects on metabolism. Basal metabolic rate is going to rise by about 15% during the second half of gestation. Appetite may be strongly stimulated. And even though a baby may be only 5 to 8 pounds, the healthy average weight gain during pregnancy is about 24 pounds. Much of this is in the weight of the fetus and the fluid inside the uterus. However, we'll also see added body fat that's useful for nutritional support of the fetus. The placenta stores nutrients in early gestation and releases them during the last trimester. The demand is especially high for protein, iron, calcium, and phosphates. A woman needs to take in extra iron during late pregnancy so that they don't become anemic. After all, there is a higher volume of blood circulating between the fetus and the mother. Vitamin K is often taken in late pregnancy to promote prothrombin synthesis in the fetus. This minimizes the risk of neonatal hemorrhage, especially in the brain. Vitamin D supplements are going to help ensure adequate calcium absorption that'll meet the fetal demand for its growing bones. And folic acid is going to reduce the risk of neurological fetal disorders. As we've seen earlier, without enough folic acid, we'll see spina bifida, where the spinal column doesn't close properly, and anencephaly. Supplements should be started way before pregnancy begins and continued throughout the gestational period. Now, there are some big impacts on the circulatory system. By full term, the placenta requires 625 milliliters of blood per minute from the mother, as well as the fetal demands. The mother's blood volume rises about 30%. This is due to fluid retention and hemopoiesis. The mother has about 1 to 2 liters of extra blood. The mother's cardiac output rises from 30% to 40% above normal by week 27. It falls almost to normal during the last 8 weeks. The pregnant uterus puts pressure on large pelvic blood vessels. This interferes with venous return from the legs, which is why we'll see fluid retention in the feet. Sometimes it results in hemorrhoids, varicose veins, and edema. In the respiratory system, the rate remains fairly constant, but the tidal volume and minute ventilation increases about 40%. There are 2 reasons for this. The oxygen demand rises in proportion to the woman's increase in metabolic rate and the increasing needs of the fetus. Progesterone increases the sensitivity of a woman's chemoreceptors to carbon dioxide. Ventilation is thus adjusted to keep her arterial pCO2 lower than normal. This promotes CO2 diffusion from fetal bloodstream into the maternal blood. As pregnancy progresses, many women feel an excess air hunger from pressure on the diaphragm, and thus they make more of an effort to breathe. Breathing is much more easy in the last month due to pelvic expansion, which allows the fetus to drop lower in the pelvic cavity, taking some of the pressure off of the diaphragm. So there are certainly some impacts in the urinary system. Aldosterone and the steroids of pregnancy promote water and salt retention by the kidneys, which naturally also promote the effects of edema. Glomerular filtration rate increases by about 50%, and urine output is slightly elevated. This enables the woman to dispose of both her own and the fetus's metabolic wastes efficiently. The pregnant uterus also compresses the bladder and reduces its capacity. So, frequent urination and uncontrollable leakage of urine or incontinence is fairly common. In the integumentary system, we're going to see that skin is growing to accommodate expansion of the abdomen and breasts. We'll see added fat deposition in the hips and thighs. Often there are going to be stretch marks or striae that result from tearing and stretching of connective tissue if the skin growth is not keeping up with the expansion. First of all, they are red, but after pregnancy they fade to more of a white color. Melanocyte activity increases in some areas, so we'll see darkening of the areola, and the linea alba from the belly button to the pubis will become the linea nigra because in a non-pregnant state it's white, and because of this melanocyte activity during pregnancy there becomes a dark line. There's sometimes temporary blotching or darkening of the skin over the nose and cheeks. It's called the mask of pregnancy, or the cloasma. So the non-pregnant uterus weighs about 50 grams. By the end of pregnancy, it's up to about 900 grams. And it extends from the pubic symphysis almost up to the xiphoid process. The table below illustrates a distribution of weight gain during pregnancy. So first of all, the fetus average about 7 pounds. The placenta, the fetal membranes, and the amniotic fluid about 4 pounds. Blood and tissue fluid, well, about 6 pounds. Fat stored around the body, about 3 pounds. The uterus itself, almost 2 pounds. And the breasts would have an additional 2 pounds in weight. This is where we get the total healthy gain of 24 pounds during pregnancy. Of course, this will vary a lot depending on the fat deposition on a woman's body. So let's take a break here. Take a moment to jot down as many of the hormones as pregnancy as you can remember, and each of their functions. Perhaps address their levels at various stages of pregnancy. After you've done that, you can move on to the lecture on the second portion of pregnancy and childbirth.